Good morning, everyone. The topic of today's discussion is principles of adhesion. It is a very important topic and in clinical point of view, and it is like most commonly asked as a short note in dental materials. Okay, so coming to the contents, we have divided into basic part and the advanced part. Advanced part we discuss about various testing methods of adhesion. We will see it in the next class. So coming to this class, the basic, which includes about introduction, what is adhesion, what is coercion, and what are the criteria for adhesion, what are the various theories for adhesion, and what causes the failure of adhesion, what are the various factors which affects adhesion, and its clinical consideration. Okay, so the various dental materials which we have and its type of adhesion with the tooth structure and various others like indirect materials also we will discuss. So coming to introduction, the term adhesion means to stick to. Okay, so it is bonding of two different materials caused by attraction of atoms or molecules. Okay, American Society for Testing on Materials defines adhesion as it is the state in which two surfaces are held together by interfacial forces. Okay, which may consist of either valence forces or interlocking forces or the both. Okay, it is a surface attachment process. Okay, so simple example is that the brick which is adhered by use of a cement. Okay, so what is an adhesive then? It is the liquid component. Okay, it is a liquid material which is viscous. It spreads it in interface between two solid substrates and creates effective bonding. So brick is an substrate whereas cement is an adhesive. Okay, so the liquid component adhesive is nothing but the cement if this brick and cement is an example. Okay, so then what is coercion? So coercion means molecules of same substances stick together. The substrate is the same in case of coercion, whereas for adhesion, there are two different substrates bind together by use of an adhesive. Okay, in coercion, they are same substances which are stick together. Example, brick is made of mixing ground clay. Okay, so clay is mixed with water to form the brick. Okay, that is a example of an coercion. So what is coercive failure? If the coercion between the molecules does not occur properly, the material breaks. Okay, so if the clay doesn't mix properly, then it will break. Then it is an example of a coercion failure. Okay, so then what is adhesive failure? As I already mentioned, adhesion means it is the process of attachment of substance to the surface of another substance by means of an adhesive. Okay, so this classic example is that when there is a adhesive failure means the substance does not adhere properly between there is a like problem with the adhesive and the adherent. Okay, so example is that wall breaks due to crack in the cement between the bricks. Okay, crack in the adhesive, that is called adhesive failure. Okay, so what is adhesive strength? So it is the measure of load bearing capacity of the adhesive joint. Okay, so adhesive strength is the load bearing capacity measure, and it is depends on the ability of adhesive to stick to the surface of the surface to bond to the substrate. Okay, so it depends on how it that adhesive bond to the substrate. So normally in dentistry, in restorative dentistry, conventionally traditional dentistry, what we used to do, we used to conventional restorative purpose, we used to prepare a cavity which includes mechanical retention properties as like we give for amalgam restoration. Okay, that mechanical will give retention for the restoration. Okay, but nowadays adhesion plays a very important role and which helps in minimally invasive dentistry. Okay, it does not extract the tooth structure, and the retention is mainly adhesive and not based on mechanical features. Okay, so it also prevents the micro leakage by providing a tight tooth restoration interface. So what is the difference between adhesion between the solids and adhesion between the liquids? In solids, usually when two substances are comes in contact, there will be a rough there will be a rough surface with peak or asperities when we see at the microscope level. Okay, as we see in this picture, these are the peaks. Okay, so when the two substrates come in contact, only the high points get in touch. Okay, so this will create some cold welding or local adhesion, and but the adhesion is very negligible. It's very minimal and very negligible. But if you introduce an adhesive like a liquid in between the two substrate, the adhesion will be more. Okay, so this is for adhesion between the solids. So in case of liquid, what is the adhesion between one substrate is solid and another substrate is liquid? Then the interacting molecules should be less than 0.0007 mm for an adhesion to occur. So there will be a good bonding. Okay. So if you put a drop of liquid on a substrate which is with the very low viscosity, and it will spread, that liquid will spread eventually, and it drives liquid over the surface. Okay, by a process called as capillary mechanism, it will even spread evenly over the substance. So there are certain criteria for adhesion and various factors which affects the adhesion. Okay, so those are substrate characteristics, wettability, viscosity of the adhesive, surface energy, and surface roughness. Okay, so I will discuss in detail. First is substrate characteristics. So if the surface of the substrate, for example, if it is a tooth and if it is a well polished, and it polished means there will be low surface energy and low wettability. Okay, so the bonding will be very less. To improve the wettability, the surface energy has to be increased. There are various techniques by which we can increase the surface energy of this substrate, which includes etching, which we used to do composite, and conditioning, which we used to do before GAC restoration. And the third one is the changing the surface chemistry. Okay, we can deposit something over the surface and which will enhance the bond of the substrate. Next is wettability. Wettability is nothing but relative affinity of liquid over the surface of the solid. It depends on multiple factors like viscosity of the liquid, wetting, and then contact angle. Okay, so what is wetting? Wetting is nothing but degree of spreading of liquid drop on the solid surface. Okay, it is nothing but an interfacial tension between a solid substrate and liquid. Okay, that results in something called as contact angle. Wetting is nothing but interfacial tension, whereas contact angle is the angle formed between the adhesive over the substrate. Okay, so wetting is the property of a liquid, and the degree of wetting is measured by the contact angle, which I will next explain in next slide. Contact angle formed by the liquid surface and interface separating the liquid and solid. Okay, so if it there is a good wetting, means it should the liquid should be able to cover substrate completely and results in a better capillary penetration and adhesion. Okay, so the next is contact angle. It is the angle formed between the liquid and the solid surface when they make contact. It depends on surface tension and surface energy. Okay, so if it is a complete wetting, means the contact angle is 0 degree. If it is less than 90 degree, it is good wetting. If it is more than 90 degree, it is poor wetting. And if it is a 180 degree, there is a no wetting at all. So the factors which governs this contact angle include surface energy, viscosity of the adhesive or liquid, surface irregularities of the substrate, and if there is any contaminants on the substrate, it will affect the contact angle and wetting. So what is surface energy? So it is the increase in energy per unit area of the surface. Okay, in liquids it is called a surface tension, whereas in solid it is called a surface energy. It is expressed in joules per meter square. So for effective wetting on substrate, surface energy of substrate must be greater than that of the coercive forces within the molecules of the liquid. Okay, so it is directly proportional to the capacity of adhesion. So it can be increased by, as I already mentioned, by etching or by conditioning with some mild acids. So when there is a high surface energy, there will be good adhesion. When there is a low surface energy, there will be less adhesion. Okay. So coming to the viscosity, it is the resistance of the liquid to flow. It is controlled by internal frictional forces within the liquid. Okay, so it resists the driving force of for spreading of the liquid. So increase in viscosity is undesirable for wetting of liquid. Contact angles are already directly proportional to the viscosity of the adhesive. If the viscosity is less, contact angles will be also less. Okay. So the theories of adhesion, there has been various theories proposed for adhesion. We will see with examples of each theory. Okay, so we can easily correlate it. The four theories which include mechanical adhesion, adsorption, diffusion adhesion, and electrostatic adhesion. So coming to mechanical adhesion theory, it is the simplest method of adhesion. So example is that the bonding of composite resin to the tooth structure. Okay, so how it adheres to the tooth structure is the micromechanical bonding by the interlocking of adhesive and composite to the irregularities present on the tooth surface or roughness on the surface of the tooth. Okay, so the adhesive liquid with low surface tension, okay, low surface tension and less viscosity penetrate readily into the crevices, and good wetting of surface occurs, and there will be better mechanical interlocking. Okay, this is the mechanical adhesion theory. Next one is the adsorption adhesion theory. This is also called as chemical adhesion or chemisorption theory. Okay, it is the chemical bonding between the adhesive and the adherent. Okay, so example for this chemical adsorption theory is that GIC. Okay, which bonds chemically to the enamel and dentin. It results in something called as chemical bonds, like either ionic or covalent bond with the substance or substrate. Okay. So the third one is the diffusion adhesion theory. When there is a two phases, the adhesive will go through that and it will forms a single phase. Okay, it is called diffusion adhesion theory. Example is that when bonding agent within the collagen network of dentin. Okay, due to interlocking between the mechanism between the mobile molecules, when these came into contact by using bonding agent, it is this mechanism is mainly depending on diffusion adhesion theory. So the rate of diffusion of this bonding agent depends upon the concentration gradient of the substrate as well as the temperature. These both are directly proportional to the diffusion rate. So last one is the electrostatic adhesion theory. The most common example is that adhesion of bacterial plaque to the enamel, okay, or the tooth structure. So the electric double layer forms are the interfaces of metal with the polymer. So it is a part of the total bonding mechanism. And we can see there will be a negative and a positive charge created. So it will attract the bacterial plaque to the enamel. So the most common failures of adhesion occurs either with the substrate or with the adhesive. Okay, so it will be either a adhesion failure or cohesion failure or the combination of both. So which is a bond failure is of three types, maybe cohesive failure, adhesive failure, or mixed mode, both the failure. Okay, so the causes for cohesive failure may be design deficiencies. Okay, so the design of the substrate or inadequate overlap strength, there will be bond line voids and there will be thermal stress. And in case of adhesive failure, there will be contaminants or improper wetting, there will be interfacial degradation or out of line adhesive. Okay, in case of both the failure, there will be like interface also, as well as the bonding, there will be improper wetting and there will be contaminants present on the substrate. So the factors which affect adhesion include composition of the substrate, which may be either organic or inorganic, or the percentage of organic or inorganic, example enamel or dentin, or presence of smear layer, okay, which leads to poor adhesion and by reducing the surface energy, or any contaminants like saliva. Okay, so the inorganic component of tooth have greater affinity of saliva, which will hinder the bonding. Okay, so water also present in the dentinal tubules, which will also compete with the adhesive to flow and to fill the crevices. So what are the clinical consideration? So enamel and dentin have different wettability, different surface characteristics. So we should know that which clinical scenario, like if there is a more enamel, which restoration we need to go depending upon the amount of tooth structure, amount of surface energy, and then how clear the cavity is. Okay. So the wettability or surface area which can increased or decreased by like application of fluoride, so or by acid etching or some other techniques. Okay, so fluoride application can be done by decreasing this to decrease the surface area we can apply topical fluoride. So fluoride treatment of enamel causes less plaque accumulation and resistance to carrot attack. It can also be increased by acid etching to enhance the penetration of bonding agents. So coming to clinical application of this topic, like adhesion, is that we will able to understand the mechanism how this bacterial plaque binds to the enamel. So how we can prevent it after doing any scaling or any restoration. The surface has to be polished that much so that there won't be any irregularities, so that the plaque won't bind. Okay. So next is that we know all the different materials have different properties, different way of binding to the different substances. So we can select the type of material depending upon the clinical scenario, and mechanical and micromechanical adhesion of fixed partial dentures, and the retention of orthodontic brackets onto the tooth enamel surface, and retention of post, mainly which involves dentin in the endodontically treated tooth, and addition of impression materials to any impression tray or elastomeric impression with the help of tray adhesive. So this adhesion plays a very important role. So this picture represents a different restorative material and the different substrate and a type of adhesion between this material and the relevant substrate. Okay. For example, if you see GIC, if it binds to enamel and dentin, it will be mainly the type of adhesion will be ionic or chemical. Okay. If it is a composite resin, it is a micromechanical, and if it is a metal, it will be mechanical interlocking. Okay. So composite resin means, example is a sandwich technique. Enamel and dentin is nothing but directly restoring GAC to the tooth structure, whereas metals is when GAC used as a luting cement. Okay. So similarly, we have different materials and substrate and different types of adhesion. You can go through it. So coming to conclusion, understanding the concept of adhesion is very important in dentistry, because the dentistry nowadays is moving towards something called as minimally invasive technique because of the advent of adhesive materials. Okay, so our aim is to preserve the natural tooth structure as much as possible and to enhance the aesthetics. So these are the references from which the contents are taken. So Craig's, Phillips, and then the materials used in dentistry by the Mahalakshmi. Okay. So in case of any queries or doubts, you can feel free to contact through mail ID or the mobile number provided. Okay. Thank you.